Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. Today, our topic is healing migraines naturally, which is such an important topic because migraines can be painful and they can significantly disrupt a person's quality of life. And I have the perfect expert to discuss this topic. She even hosts her own podcast called Healing Migraines Naturally. Dr. Leslie Cisar is a naturopathic physician who specializes in treating migraines with a more comprehensive, holistic approach. She is also an international speaker and teacher on the topic of naturopathic medicine. But before we dive in, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, cognizin citicoline, which is nature's way of keeping the brain's energy-producing centers firing on all cylinders. If you're looking for a way to enhance your brain function, including memory, focus, and attention, look for Cognizin on the label or go to cognizin.com. ProThrivers Wellness Brain is a product that contains cognizin as well as other brain-supporting nutrients and herbs. You can find ProThrivers Wellness Brain online at pureformulas.com. There's also ProThrivers Wellness Sleep, which combines higher dose melatonin and other sleep-supporting natural ingredients specifically designed for thrivers. You can find ProThrivers Wellness Sleep also at pureformulas.com. And Dr. Ohhira's Probiotics, it's a best-selling probiotic for more than 30 years. It contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at DrOhhiraProbiotics.com. Dr. Cisar, thank you so much for joining me.
Thank you, Karolyn, for having me. I'm really excited to talk with you today.
Yeah, I mean, this is definitely your area of expertise, but let's begin with the basics. What exactly is a migraine?
Well, it's a great question. Migraines are very common, particularly in women. So about 20% of women will experience a migraine at some point in time. It's at some point during their life. The most classic presentation of migraine is head pain, pounding, excruciating, debilitating head pain. And there can be other symptoms that come along with that. So people may experience nausea, even to the point of vomiting. They might experience, tummy upset, loose stools, constipation, just a general sick feeling, a fatigue feeling, and then other symptoms like yawning, watery eyes, vision changes. Very characteristic would be sensitivity to light, sensitivity to sound. That's what is those are common symptoms of what are called classic migraine. And those are pretty prevalent. Migraines used to be called sick headaches. So if you're going through sort of the old medical literature, they're going to be called sick headaches. And a lot of people will say, oh yeah, my grandmother always used to say that she would get sick headaches. And they were called sick headaches because people feel very sick. You almost feel like you might have the flu or something like that. It's a very sick feeling in addition to the head pain.
Yeah. And I've actually experienced migraine. So it is, and this is a long list of some pretty upsetting, symptoms of migraine. What about aura? I've heard about auras. How does that relate to migraines?
Yeah, so auras are less prevalent. So you can have a visual aura with or without the head pain. So the most common presentation is that the aura will start, and this is a visual disturbance that most commonly starts off as like a little tiny speck in the field of vision. Oh, it seems a little, is there something on my glasses? Oh, do I have a little, a little maybe mucus or something in my eye, a little fuzziness. And then it starts to grow and it starts to scintillate. So it looks sort of like a kaleidoscope type pattern, a little scintillating. Sometimes it'll be black and white, sometimes it'll be more colorful. And that little speck will start to develop this scintillating pattern, and then it will start to grow. The circle of it will expand and expand. And then frequently the center will clear, and then you sort of have this scintillating donut that gets bigger and bigger, expands across the whole visual field. Typically that lasts for 20 minutes. And then the head pain will start after that. Anywhere from another 20, 30, 45 minutes or so is very typical. So it's not as common for people to experience an aura, but that can also be a feature of migraines. Some people will have the aura without the head pain.
Kind of freaky.
So yeah, the most common when people have their first aura, the first time I had an aura, I thought I was having a stroke. And this is what most people think, right?
Mm-hmm.
Something horrible is going on here because my vision is affected. So I'm either having a stroke or my retina is detaching, from the back of my eye. That's what people assume is happening. But that's not the case. Nothing is actually happening on the surface of the retina or inside of your eye. The phenomenon is happening in your visual cortex, the part of your brain that processes the signals coming in from your eye through the optic nerve. So there's nothing wrong with your eye, but it certainly seems that way when you're having it. So many people might rush to the ER, rush into the eye doctor, fearing that their retina's detaching or they're having a stroke, et cetera. It's very anxiety provoking.
Mm-hmm, yeah. Let's talk a little bit about causes. Like in my case, I developed migraines after my cancer, and they were hormonally related. What are some of the more common causes of migraine?
Yeah, so this is you're stepping into a big debate within the migraine world. So a lot of times when people talk about causes for migraines, they're talking about what are called migraine triggers. So sometimes people will say, well, I have hormonal migraines, right? The hormones are triggering the migraine or they're causing the migraine. Other people will say, well, if I know if I go to like a rock concert, all that noise is going to trigger the migraine or cause the migraine. Or a lot of times people will think that the food is triggering the migraine, right? So if you Google migraine food triggers, you're going to find tons of articles with lists of food that you shouldn't eat if you have a migraine because they trigger migraines or cause migraines. So, and I don't subscribe to the trigger theory of migraines. I think that theory doesn't play out when we really dig into it. But usually when people are talking about what causes migraines, they're really asking like, okay, what is triggering my migraine? And people there is a correlation, right? So some people are very sensitive to noise. Some people are very sensitive to particular nutrients in different foods. Some people have difficulty detoxifying their hormones every month. And so so there is a correlation that people will notice between certain things and their migraines, but it's not actually those things that are causing the migraine.
That's a great clarification. Thank you for that. Why do you use a more holistic approach when it comes to healing migraines?
Well, everybody wants to get to the root cause, right? And so when you go into an allopathic doctor, they are going to give you a prescription medication. And in the allopathic doctor's mind, the prescription is treating the root cause of the problem, whether it's migraines or some other condition, right? But I think that most people have sort of an intuitive sense that the medication is not really getting to the root cause, right?
Mhm.
The medication is more like a little Band-Aid on the problem on that the symptom is causing for us. So that's what drives a lot of people. That's definitely what drove me to looking for the actual root cause, right? So number one, I think most people are looking for what we might call a more holistic approach, a more natural medicine approach, because they really want to address the actual root cause of the symptoms. The other reason for taking what we might call a holistic approach or actually addressing the root cause is because when we take a medication to treat the symptoms, the body is being the biochemistry of the body is sort of being manipulated by the drug, by the medication. And our body fights that biochemical manipulation. Our body is generating the symptoms, the body is generating the aura and then the horrible pounding head pain afterwards for a reason. We may not appreciate the symptoms, we may not appreciate the reason, but if we come in and try to alter the biochemistry that's generating that symptom, the body says, no, I want to generate this particular biochemistry. You may find it unpleasant, but I'm generating that particular biochemistry for a reason. So now I'm going to fight what you're doing with that medication. So what happens over time is that the medication becomes less and less effective.
Mm.
So everybody, any of my clients, they will say, when I first started getting migraines, I tried Advil, I tried Excedrin. I was able to get by with those over-the-counter products at first, but then they became less and less effective. I really did not want to go into the neurologist and get a prescription, but I was desperate. And I thought, you know what, if I only need to take this Imitrex, once or twice a month, even though I hate to take medication, I guess I'll do that. I mean, I have to go to work. I have to take care of my family. I'll bite the bullet and do that.
Mm-hmm.
But then over time, because their body is fighting the suppression that the Imitrex is generating, well, now the migraine frequency and severity starts to increase. So what was 1 or 2 doses a month now turns into 5, turns into 10, turns into 15.
Mm.
So this is what also drives people to take another approach, because the medication, unfortunately, given enough time, is going to stop working. It's not going to be able to suppress the symptoms because the body is going to get better and better at fighting the effects of the medication.
Yeah, that makes a lot of sense. You build up a resistance. So let's dig into your natural approach. And I realize that you utilize an individualized strategy, but where do you like to begin?
Well, so within naturopathic medicine, we have a particular theory around what causes disease and how do you restore people back to health. So I use our naturopathic principles. So in naturopathic medicine, when the body falls out of a state of health, right? So we, in our culture, unfortunately, we think that our body is broken and defective when we experience symptoms, right? In fact, I have a client whose neurologist told her that her brain had faulty wiring, and that's why she got migraines. I mean, so we have been told that we are experiencing these symptoms because something is broken, defective. We have faulty genes, bad genes, which is basically a scientific way of saying you're unlucky, right?
Mm-hmm.
But within naturopathic medicine, we believe that the symptoms are being generated because we've fallen out of a state of health and the body wants to get back into a state of health. Every living thing on the planet has a self-healing mechanism, right? Even a plant, if a plant, you kind of rip a leaf on your house plant, even your house plant starts to repair that damage to the leaf. So our bodies are designed to get back into a state of health. We get stuck out of health. When someone has chronic migraines, they're sort of stuck out of health. And there are 3 things that we have to do to restore ourselves back to health. And I call these things the 3 principles. So number 1, if our body is generating symptoms and we're kind of stuck out of health, number 1, we're going to have what we call in naturopathic medicine, a blood deficiency. There's going to be some deficiencies in the blood. Could be nutrient deficiencies, could be hormone deficiencies or excesses. So for example, with menstrual related migraines, it's usually being driven by an excessive amount of estrogen and estrogen metabolites in the body. So we can have deficiencies or excesses in the components that are supposed to be in the blood. So we need to look at, okay, what indicators are we getting that there are these deficiencies or excesses within the blood? That's step number 1. Number 2, in naturopathic theory, we have to clear metabolic waste material and other toxins from the body. So every cell in our body is continuously generating metabolic waste material. We're exposed to toxins in the environment. The medications that we take have to be cleared from the body. Our body is designed to clear these substances, but if there's a backlog, if there's an overload, we're not going to feel well. Okay? If those waste materials are kind of stuck in the cell, stuck in the body, we're not going to feel very good. Okay, so in naturopathic theory, we're looking at, okay, what are the indicators that we have an overload of this metabolic waste material and toxins in the body? And then what is going to be the best way to support the body to do what it is designed to do, to get these materials out of the body without harming the body, okay? Without putting the body through too much stress while we're doing that. And then the third piece is we have to restore our resiliency and vitality. So there's an organizing energy to the body, to the system, that keeps the system in homeostasis, keeps it in balance. I like to think of this as we sort of have this compass needle that's pointing north. When we are in a state of health, our needle is pointing north. We're in the green zone. Our body is not generating symptoms. But in naturopathic theory, we can see that this needle is continuously getting knocked down towards west by stressors, physical stressors and mental and emotional stressors. That's sort of knocking that needle, pushing that needle down on that compass dial towards west. It's our own resiliency and vitality that pushes that needle back up to north. So when people have a chronic health condition, when they're chronically experiencing symptoms, it's like that needle is stuck on the northwest side of that dial. We have to increase our resiliency and vitality so that we can push that needle back up to north and get back into balance, into a state of health, into homeostasis. So we have to look at, okay, what is draining the resiliency and vitality in this particular person? And there can be some habits. People can have vitality draining or vitality enhancing habits. For example, if I stay up until 2 a.m. every night playing video games, that's not going to be a vitality enhancing lifestyle habit, right? And then we can have things on the mental and emotional side of us that are also draining our vitality. So we have to look at these factors as well. And if we need to do any sort of tidying up or cleanup, we need to do that as well.
Yeah. And it sounds like a very comprehensive approach, but sometimes with an acute migraine, the person just wants some relief. Are there natural or more holistic things that can be done when a person is in the throes of a migraine?
Yeah, great question. And this is something that people are looking for. They're desperate for something that they can take that's quote unquote natural, that's going to make them feel better, that's going to work sort of like an Imitrex or, um, an Excedrin. And unfortunately, there really are, you're really not going to find a lot of effective natural abortives. Okay. There are really, you're looking at more little natural band-aids. And with my clients, I actually don't promote the use of some of these little natural band-aid options. Something like taking some high dose magnesium, taking some ginger if you're nauseous. I have found that things like butterbur or feverfew herbs that are touted rarely give people relief. These are all little natural band-aids. When a migraine kicks off, it's a very complex neurological storm that is kicked off. They really don't understand the physiology of what generates the migraine. It's a very, very mysterious neurological condition. So when that storm gets set off, a little bit of ginger, a little bit of magnesium, a little bit of turmeric, these types of things that you'll find online, it's really going to be a real drop in the bucket. People can take opiate pain medication and still have the pain of the migraine headache. So some of these natural, like I say, I call them natural Band-Aids. They don't consistently work from person to person, from migraine flare to migraine flare. And what I think is very important when people are recovering from chronic migraines is to not be demoralized as they're suffering from the migraine. So they've already been told by their doctor that they're defective, they've got bad genes, they've just pulled a bad hand. And then when you start kind of trying to piece together these little natural Band-Aids, it can be very demoralizing. You might take ginger during one migraine flare and feel a little bit better, but then the next migraine flare, you take the ginger again and it doesn't do anything for you. And this can really be demotivating for people. My focus is let's get you feeling better as fast as possible. And then you don't have to worry about taking your over-the-counter, your prescription, or any of these natural Band-Aids because they don't work consistently.
Yeah, that's such a interesting concept. So you focus straight away on improving ASAP so the Band-Aids aren't needed.
Exactly. I think,
great.
I have scoured because migraine headaches have been written about in the naturopathic literature. If you go back to the early naturopathic writings, the eclectic herbalists, these little natural remedies have been documented in the source material. And I have gone through the material and I have tested these things out. And maybe they worked 100 years ago. I have to assume that if they were written about and touted, they had to have some efficacy. But unfortunately, because of what this is my theory, I think because we have taken so much medication, because now we have the medication available, right? 100 years ago, you couldn't take an Advil. There were no triptans. So now people, they have that head pain. Well, let me start with Advil. Let me try Excedrin. Now let me try a prescription. by the time they're coming to a natural practitioner, they've already taken how many doses of medication?
Mm-hmm.
And the body is now fighting the medication and generating more severe migraines.
Mm-hmm.
So what maybe worked 100 years ago before these suppressive drug therapies, I don't find works today.
Yeah, interesting. Okay, so we only have a minute or so left. What final pieces of advice do you have for listeners who suffer from migraines?
The most important thing is to not believe that you're broken and defective. You know, if your neurologist has told you the equivalent that you have faulty wiring in your brain, then you are defeated before you even start.
Mm-hmm.
Migraines are excruciating. They are very common. They're one of the most common reasons why people go on disability. But you can recover. You can restore your health, and your body will stop generating the migraines when you restore your health. But if you believe that you're defective, that you're broken, that you have bad genes, you won't even consider that to be a possibility.
Mm-hmm.
And this is the biggest barrier for people to get out of, to step off of the migraine roller coaster. That's the biggest barrier, is thinking that, well, what can I do? I have bad genes. Or, well, maybe when I go through menopause, it'll get better because that's what my doctor told me.
Mm-hmm.
I've got a problem with my hormones, so I guess I'll just wait it out.
Yeah, it's such good advice because the mind is so powerful and what we believe is so powerful. So if we can change that philosophy, we have a leg up. I want to remind our listeners that if they want to find out more information about you and your work, they can visit your website, drlesliecisar.com, and that's DrLeslieCisar.com, drlesliecisar.com. Well, you're doing great work, Dr. Cisar. Thank you so much for joining me.
Thank you for having me.
Well, this has been a great, we'll have to have you back on because I feel like we just touched the surface on this topic. It's a big topic. No wonder you have a whole podcast devoted on it. And your podcast, again, is called Healing Migraines Naturally with Dr. Leslie Cisar. So that wraps up this episode of 5 to Thrive Live. Once again, I'd like to thank our sponsors, Pro Thrivers Wellness Sleep Formula, Cetria glutathione, the superior glutathione to support liver and immune health, cognizant acetylcholine to help enhance memory, focus, and attention, and Dr. Ohhira's award-winning shelf-stable probiotic. Well, this has been a great show. May you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.